This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. I'm Mark Alyn. During the next 2 hours, we're going to be talking about everything from a cardiologist who went back to school and became a chef. We're going to do that. And we're also going to talk about something this hour that I think is very important. With the time change through much of the country, we're going to talk about something called SAD. And we'll find out more about that in about 30 minutes from now. Right now, we go back to Washington, D.C., and we're going to speak with the Executive Director and CEO of the Natural Products Association, Daniel Fabricant, Dr. Daniel Fabricant. Daniel, welcome back to Late Night Health.
Thanks for having me again, Mark. Always good to talk to you.
Always good to talk to you as well. And I am going to personally apologize. We were supposed to have you on months ago, and I fell off the boat. But I'll get back on, and you and I will chat.
No need to apologize, Mark. Always happy to speak with you and in your audience. I think it's no matter the timing, it's like riding a bike. We just get right back on and catch right back up.
Got it. Well, I appreciate that a lot. Recently, the NPA challenged a new study on supplements and emergency room visits, and that's going to be part of our topic today. Can you explain what the study was from the New England Journal of Medicine?
Yeah, it was kind of an odd mathematical exercise in that they looked at emergency room visits or some small subset of emergency room visits and made some extrapolations about dangers of supplements. The fact of the matter is really adverse events, that are directly associated and can be tied to supplements, some sort of relationships can be shown, are extremely low given their widespread usage. And most of these are really the results of accidents, people not consulting their doctor, healthcare practitioner, or misuse of a combined product with other health factors. I think supplements are generally safe, which is why millions of Americans are using them every day.
And what percentage of Americans are using supplements? Do we know?
By numbers we have and other groups have, it's over 60%. So you're looking at, approximately 180 million people.
Wow. That's a lot.
Yeah. Not bad.
Not bad at all. I did some research this morning, and I'm not going to give numbers, but I guess the extrapolation that was given in the New England Journal of Medicine that said that from 2004 to 2013, 23,000 hospital visits each year, approximately, they did use the word approximately, were from supplements. But the number of problems with prescription drugs are in the hundreds of thousands.
And I'm not even going to go there with prescription drugs, Mark. I think the challenge was this, is FDA by law gets mandatory adverse event reports. The peak of that was about 3,300 in 2012 when I was at the agency. So the adverse event reports actually have some real metrics to them, there's some real goodness behind them, whereas I think this study tried to make it like these visits that, again, weren't a real number, but an extrapolated number, were all directly caused by supplementation. There was really no discussion of the fact that, similarly to when people get older, it's tougher for them to swallow food and incidences of choking goes up. Well, dietary supplements are a category of food, so it's probably not a surprise as people get older, there are more likely to be visits to the emergency room for people choking on a supplement, food, what have you, and none of that was teased out. So it was an unfortunate way of positioning things.
You spent how many years at the FDA?
About 3.5.
And you were in charge of
dietary supplements.
And you were the part of the enforcement team, if you will.
Yes.
Right?
Yes, I was, and adverse event reports were very important for my job. And so, I think for me, as a reformed regulator, or I guess you would say a recovering regulator, it's certainly, I think that the data, keeping data pristine and having real data versus data like this that's kind of just a mathematical creation, it's not good for anybody.
I know you're not going to want to answer this, but I have to ask. The industry, and I talk to a lot of people on both allopathic, traditional doctors. We're going to be talking with the chef who's a cardiologist later in the show. He does not believe in supplementation. He says we get enough from our food there may be some instances where people should have supplementation. But he said generally he doesn't believe in it. Okay, that's fine. But I find that there's this dichotomy between Big Pharma and supplements. It just seems that there's an ongoing fight, and I don't understand it.
I wouldn't say it's a Big Pharma versus supplements dichotomy. I think what there is, Mark, and you touched on it very nicely, is I think that there are folks that have there's kind of two polar opposites, as there seem to be a lot of things right now, whether it's political, what have you, or college football season. But
right.
I think the two polar opposites are, the one side is, hey, use supplements, there's a benefit. The other side is no way, no how. And I think they're both, on some level, I think the side that's more engaged with the consumer is the side saying use supplements, they work, whereas the side no way, no how. I think physicians that say, hey, don't use a supplement under any circumstance, okay, all they're doing is they're not guaranteeing that their patients are not going to use supplements. They're guaranteeing that their patients who do use supplements are never going to talk to them about it. And that's not a good thing.
That is not a good thing. Are supplement regulations enough at this point to protect the American people? I mean, the FDA is designed to protect us from bad drugs, bad supplements, bad. Are the regulations that are set, in your opinion, are they enough to protect us?
I mean, they work. I certainly worked them. I was there at the FDA and worked them, and they work. I think you can sit around and say, hey, what's the perfect system? I don't know that there's ever, don't let the perfect be the enemy of the good. There's legal aspects there that work. There's legal aspects there to ensure consumers are protected. FDA has to show the willpower, the manpower, and to move these things ahead. So, in my experience is that the laws work. Any system of regulation, there's never regulatory perfection. At the same time, with so many people, the facts are that adverse events from supplements are extremely low compared to the use. I think that's part of the reason why the industry's grown so much is the demand for really natural alternatives just keeps growing because people are looking for something different.
And something different that doesn't have side effects, that don't cause other problems. Our guest is the executive director and CEO of the Natural Products Association, which Late Night Health is a proud member of, by the way, Daniel Fabricant. Daniel, for the last 75 years, would you say that the NPA has also been around to protect the consumer as well as the manufacturers?
Yeah, I mean, I think it starts with, it's a bad business model for any industry to want to harm the consumer, right? I don't think that's what the industry's about in any aspect. It's really there the consumer is looking for options. The consumer is looking for doing things in a healthier way, embracing a healthier lifestyle. So, yeah, I think that by making sure that the industry gets a fair shake with Congress, with the regulators, with the judicial branch, it enables consumers to have greater options in the marketplace, which is clearly what they're interested in.
Do you personally take supplements?
I do, and my kids do too.
I met your kids in March.
Yeah. My daughter, she's for a 3-year-old, she keeps my hands full, so I have to keep at least a multivitamin in my body to keep up with her. Yeah,
I remember those days. The use of supplements, you just said, is growing, and why?
Well, I think there's a few things. I think one, folks in general aren't crazy about the experience they have with their physician or with their mainstream, if you will. You use the word, allopathic medical experience. I think they want to have a lot of responsibility over their care. It's the information age, so they're getting a lot of information. They're doing more research. They're doing more vetting on their own, and they're going, is this right for me? This seems like it would be a good fit for me, given my diet, my exercise pattern, my lifestyle in general. So I think that's the biggest driver. There are other lifestyle choices, but I think that's the biggest driver. And I think, one thing you're seeing, Mark, which is fascinating in all this discussion, is you're actually seeing a time where hospitals, allopathic medicine, are adding supplements to their formularies. I think that if hospitals thought that there wasn't a benefit, or more to the point that there weren't legitimate concerns, they certainly wouldn't be doing that. So I think you're seeing more and more of an integration of, kind of the system of health care, or some people say sick care, but really a trend more towards well-being prevention.
We found, we were talking to somebody in the last week or two, Dr. Catherine Stengel from in New York, and she does a form of acupressure energy healing, and there are hospitals, allopathic hospitals, that have been training their nurses in this, I don't know, new age, 1,000-year-old technique, which I find fascinating. And so there, I guess maybe the medical community, the traditional medical community, is saying, maybe there are other ways. And I think that's a positive thing. Our guest is Daniel Fabricant, the Executive Director and CEO of the Natural Products Association. He's been on the show a number of times, and we look forward to him coming back again soon. We've got some more time with Daniel. I know he's very busy. He was, I guess you were up on the Hill this morning, right?
Yes, yeah. It's been an interesting time with the changes in leadership right now in Washington. But it's never a dull moment, as they say.
Okay, we're going to take a time out for just a moment or two, do some business, and when we come back, we're going to continue our discussion, and we're going to move to the West Coast, I think, and talk about the response to the Oregon Attorney General's lawsuit against GNC. That'll be happening here on Late Night Health. Join us at latenighthealth.com, latenighthealth.com, for more information on the NPA. Back after this.